राहुल तुम्हारी वॉइस बहुत स्लो आ रही है।
ओके सर, 5 आ रही है सर अब।
हाँ, मेरे को आवाज आ रही है।
ओके।
ओके।
5 4 3 2 1। We all are live now, sir. We can start the.
Very good afternoon, everyone. On behalf of NASH 24 by 7, I welcome you to our public program on the current management of happiness. NASH 24 by 7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have the renowned gastroenterologist from Jaipur, Dr. C.P. Tanwar. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. C.P. Tanwar is a leading gastro in Jaipur, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has no experience building. He has experience building a clinical skill set that allows him to deal with the patient-centric care. He is currently associated with Fortis Hospital at Jaipur. Sir, we salute your dedication to spreading awareness related to liver health. So
Thank
now
you.
I invite Dr. C.P. Tanwar to enlighten us on the topic, the current management of NAFL and NASH. Sir, over
Yeah.
to you.
Uh, Thank you very much for the warm welcome. Today, I would be discussing a few things about the very common disease which is growing very rapidly in our country because of the epidemic of obesity and diabetes. It is getting very common nowadays. So, we will be studying about the fatty liver, that is non-alcoholic fatty liver disease, and how to fight it. Next. So, as you know, that the liver is the second largest organ of our human body, and it weighs at an average of 1.5 kgs with approximately 5% of the fat. It is located on our upper right hand portion of the abdominal cavity on the top of the stomach and the intestine. It is usually a pinkish brown in color with soft consistency, and it is highly vascular because it has a very rich blood supply by both portal vein and hepatic artery. Next. So what are the functions of the liver? As you can see, it has a plethora of functions. Basically, it is also called as the chemical factory of our body. Like it can, it regulates our blood composition. It produces bile. It produces protein and cholesterols. It controls approximately 500 metabolic processes. It breaks down the alcohol and the different medicines which we take. It breaks down them, detoxifies the blood. It destroys the old RBCs and it processes the nutrients. Next. So the important is what is NAFLD. So we need to understand what is fatty liver disease, especially non-alcoholic fatty liver disease. So it's a condition in which the fat cells they makes up more than 5% of the liver weight, which is not caused by alcohol use. So if it is left untreated, it can lead to a severe condition like non-alcoholic steatohepatitis. So being overweight or obese, having type 2 diabetes or having high cholesterol levels, they are associated with the increased risk of fatty liver disease. Next. As you can see that one out of four people, so they have NAFLD regardless of their weight. So even if you are lean, then then also there are chances of you having the fatty liver disease. So it's very prevalent disease. You can see that approximately 25% of Indian population is supposed to be affected by this disease. And if we talk particularly about those who are diabetics and those who are obese, the ratio becomes more severe. As you can see, more than six diabetics and more than nine severely obese patients, they have NAFLD out of 10 patients. So you can see it's very severely found in diabetics and obese people. And especially is the male gender. It has been regarded as a risk factor for the progression of the disease to NASH and fibrosis. Next. As you can see now here, this is a pictorial diagram which is showing the progression of a healthy liver from the right side of the screen to the left. You can see that it progresses gradually into fatty liver disease when there is a deposition of the fat cells, and which eventually over years it can develop into a more dangerous situation wherein the liver cells they become fibrotic, they become hard, and finally a stage comes when the whole the liver gets get destroyed by the scar tissues and liver is unable to now function properly called as the cirrhosis of the liver. Next. Now, what is fatty liver? Fatty liver means just a simple accumulation of fat. But what is NASH, which is a more dangerous form? It means along with the accumulation of fat, there is some inflammation, some swelling is going inside, and there's some scarring is also going inside. So that is called as steatosis. Next. So what are the risk factors or the why they are being seen? As you can see that obese persons and those who have metabolic syndrome, that means those who have associated hypertension, lipid profile. So those patients and those who are certainly exposed to a few medicines are there, like valproate is there. Those who are leading a very sedentary lifestyle, like they are not active physically. Those who have a food intake which is consisting more of the junk food, the fast food, fat and fatty meals, sugary meals, and those who have some genetic background, so they have a predisposing factor to develop the non-alcoholic fatty liver disease. Next. So what is the a role of obesity and fatty liver disease? As you can see that being overweight or obesity, it causes more of the fat to accumulate in the liver, and obesity increases the amount of fat to around 5 to 10%, and which leads to the steatohepatitis and the scarring of the liver. Next. So what is the relation between fatty liver and diabetes? So it is a bi-directional, means so those who have diabetes, they have a more risk of NAFLD, and those who have fatty liver disease, in those population, there is seen that they have a high prevalence of diabetes. They have around 2 to 4 fold high risk of developing diabetes. But the together, if we see that diabetics and fatty liver, they have threefold increased risk of death due to the cirrhosis. So basically, they are interrelated to each other. Next. So now, this what are the symptoms of fatty liver disease? As you can see, that many of the people they do not have any symptoms at all, and those who do, they have only simple symptoms like they have a mild fatigue, or they may be having some discomfort in their upper part of the right side of the abdomen. And in major, or you can see in the advanced cases only when the disease has developed to steatohepatitis or the cirrhosis, that the patient will complain of increased fatigue, nausea. There may be some fullness of the abdominal cavity. There may be some confusion, or there may be some GI bleeding or swelling, unexplained weight loss, and esophageal varices. So these are advanced features, but in majority the patients they do not have symptoms. They are asymptomatic. Only the complaints of mild fatigue. Next. So how to diagnose it? See, basically it can be a silent killer because the progression is very slow. And the diagnosis, what we do certain tests like blood tests are there, like liver function tests. I will be discussing it. And there are certain other imaging tests, like we have an ultrasound, fibroscan. In a few cases, direct biopsy of the liver, which is a gold standard to diagnosis. And then we have certain other imaging facilities like X-ray, CTA, or MRI. They can also be helpful to diagnose patients who are having the NAFLD. Next. So, what are the most common blood tests? The most common blood tests are SGPT and SGOT level, or you can say ALT or AST. So, here you can see that the persistently elevated ALT they can be associated with the disease progression. Patients who have normal ALT levels they can also develop progressive disease, and up to 80% of the patients they have normal ALT levels. So, there is no designated cutoff of ALT to predict that the patient has NASH or any advanced fibrosis, but these are commonly elevated in the patients who have fatty liver disease. Next. So then there are, you can see we have blood tests, and by this blood test, we can actually, we have developed some various scoring methods. So like there is a called FIB, which includes age, AST, ALT, platelet counts. Then we have NAFLD fibrosis score, which includes blood sugar, BMI, albumin also. So these are available online, and you can actually get to know how serious is your fatty liver disease, and they have been established to diagnose, and they are more better than ALT or AST alone. Next. So what are the non-invasive? So non-invasive means that we don't need to go inside, but we can see from the outside only. So we have an ultrasound, which is very easily available and it is economic one. And it is the reason actually we are prescribing sonography for some other reasons, and the patient is found to have some fatty liver. So it's an incidental diagnosis basically. And as you can see here, there are three different images showing the normal liver followed by fatty liver. When there's more of the darkness here, Cirrhotic liver means the liver has got a smaller one, it is shrunken now. So it detects only when the fat is more than 25%. That is its disadvantage because in the majority of the patient, when they becomes sonographically visible, so the fat content needs to be more than one fourth of the liver. And it also cannot differentiate the fat and the fibrosis part. Next. Then we have nowadays a very good and very important test called as transient elastography or fibroscan. So this is very important test and it has helped us to diagnose NAFLD patients even with the fat content of more than 10%. And it also differentiates between the hardness, that is the fibrotic part and the fat part, and it is also very easy to operate. But the only disadvantage is this that we cannot actually interpret it in obese patients, those who are very much obese. Otherwise, it's a wonderful test. Next. So the liver scan or the fibroscan, it works on the principle of transient elastography. So there are two things which we actually get to know. One is the liver stiffness measurement, which indicates the degree of hardness of the fibrosis. Another one is the CAP value, which indicates the degree of the percentage of the fat or the steatosis in the liver. Next. So we have another test called as the MRI PDFF test. It is very good test, very, and it is also called as the gold standard test to detect the fat content. Even it can detect the fat content more than 1%, and it is only used in patients who are actually liver donor patients. It is not widely available. That is its problem, and it is very costly. So we cannot order in every patient. Next. So the gold standard test, that is invasive test, that is liver biopsy. So here you can see a smaller slender core of tissue is removed with the biopsy needle. So it's a gold standard method, but an only method to diagnose steatohepatitis and to rule out other liver disease. But the problem is this: we need to hospitalize the patient, and the patient, it is a very painful procedure and individually dependent. Chances of misdiagnosis are also there in the early years. Next. So progression of fatty liver takes years. So that is very important that early intervention is what actually is very important, and it should be done. And because it not only reduces the risk of developing the further progression, but also protects from other liver disease which are associated with metabolic diseases. So as you can see that 70 to 75% of the patients who have this have NAFLD, they have only isolated fatty liver. So there is no increased risk of that. A few of the patients, they may develop fatty liver with mild inflammation. And in 20 to 25% of the patients, they develop the advanced forms like NASH, in which there is increased risk of death because of the cardiovascular malignancy or liver-related diseases. And they have also more chances of developing fibrosis. And out of this 25%, only 11% of them, they have NASH with cirrhosis. And out of them, only 7.2% over a few years, they may develop hepatocellular carcinoma. And only 9, and then 19 to 40% of the patient over 7 to 10 years, they develop decompensation. So as you can see that majority of the patients, they remain asymptomatic, but quite a significant group that develop to complications. Next. So we need to act before it's too late because the NASH is a more serious form of the disease which we do not want because it may lead to cirrhosis or liver cancer. And then if it reaches to a stage that is severe NASH, then it becomes not irreversible. And it also increases the risk of heart-related diseases. So we have to act fast. Next. So what we can do? The very important thing, you need to first of all speak to your doctor about the treatment options. Well, most important thing is to have a dietary changes. I mean, reduce the fat content, reduce the saturated fat content actually, and reduce carbohydrates, simple carbohydrates, increase fresh fruits, vegetables, lean meat, and then exercise is very important. Both aerobic and anaerobic exercises are very helpful. Lifestyle modification, you need to cut down the alcohol, in fact, even quit it, reduce the smoking, and then definitely there are certain medicines are available which can be prescribed by your treating doctors. Next. So it's very important that weight loss has to be done. And so combination of a hypocaloric diet and moderate intensity exercise, they provide the best likelihood to sustain the weight loss. We say that a weight loss of around 3 to 5% of body weight, it improves the steatosis part and a weight loss of around 7 to 10% improves the majority of the histopathological features of NASH, including fibrosis. Next. So as we can see here, the effect of weight loss, if it is more than 2 to 3%, the reduction of steatosis. If the patient has inflammation, a weight loss of more than 5% is recommended. And for the resolution of NASH, more than 7% of the weight loss, and 5 for reduction of fibrosis, and more than 10% or equal to 10% of weight loss is advised. Next. So what is a healthy diet for a fatty liver? So we should follow the Mediterranean diet. Everyday diet should include vegetables, fruits, whole wheat, grains, olive oil, beans, nuts, legumes, seeds, herbs, and spices. And often you can take twice a day, like twice a week, each week, fish and seafood. And then weekly you can have this moderate portions of poultry, eggs, cheese, and yogurt, but less often. You should avoid this red meat and sweets. Next. So role of exercises, I said both aerobic and resistance exercises are helpful. Aerobic exercise reduces the fat, maintains a healthy weight, improves your cardiovascular condition. Resistance exercise reduces liver inflammations, improves the glucose absorption, insulin sensitivity, improves metabolic parameters with lesser energy consumption. So fatty liver can be improved and it can be reversible into a normal healthy liver. Next. So tips to tackle fatty liver is to get enough vitamins, minerals, get enough sleep, develop an exercise routine, stick to it. Need to go for regular medical checkups. You need to eat small, frequent meals, lower down your sugar intake. Next. So what is the pharmacological approach? So according to the Indian Society, that is in NASH Society, there are 3 drugs which are commonly used. Pioglitazone can be used in NASH with or without fibrosis in both diabetic, non-diabetic patient. Minimum suggested duration is for 2 years. Saroglitazone, NASH with or without fibrosis in both diabetic, non-diabetic population, use minimum duration 1 year. Vitamin A with or without fibrosis, but in non-diabetic population and pediatric population. So 2 years it can be used for suggested minimum duration. Next. So to prevent a fatty liver, you need to limit the intake of saturated fats and trans fats, eat a balanced diet, limit the consumption of refined carbohydrates, maintain a healthy weight, quit smoking, exercise daily, limit or avoid alcohol, take medicines as prescribed. Next. So I think I have covered most of the part related to the fatty liver disease. And if anyone has any question regarding to non-alcoholic fatty liver disease or any other questions, you can actually ask me.
Thank you, sir, for this wonderful talk. Definitely, this has enlightened us. Now we will take the question from our audience with your permission.
Yeah, sure, sure.
Sir, there is a one commonly question is asked by the patient is that when we have to consult the specialist for this NAFLD and NASH.
Yeah, so if the patient has some family history of liver cirrhosis, or if he has, fatty liver disease which is advanced, they are showing SGOT, SGPT levels which are elevated, and those who have, obesity along with metabolic syndrome, and those who have developed the complications like they have developed jaundice or severe pain in abdomen. So in those population, I think they need to actually consult a gastroenterologist.
Thank you, sir. So, sir, on behalf of NASH 24/7, I thank you for this lively and informative talk. For our audience, as you have been emphasizing the awareness for the liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctors and continue medication.
Yes,
With
sir.
careful observation and precautions, it is possible to obtain control of the disease.
Yes,
I would
definitely.
also thank to our audience for their active participation and the patience to making this event successful. Stay connected with NASH 24/7 on Facebook and take care of yourself and your family members. Thank you, sir. Thank you.
Thank you. Thank you.